Hey Dr. Vasu, what motivates you to help patients with lipedema on their journey to feeling better about themselves?
You know what? A lot of people don't actually know that I do a variety of operations, not just lipedema surgery. And of all the operations I do, be it breast surgery or facelifts or body contouring or lipedema surgery, of all of them, the one that gives me the most satisfaction is the lipedema surgery. And I often tell the patients that before I do their surgery, when I first see them on the morning of their surgery. And the reason being is that I see such a dramatic difference at the end of the operation. And I know personally how much of a positive impact it has on them. Not just physically and aesthetically, but it has on their entire lives. Their relationships improve, they go out more, they socialise more. So as a doctor, nothing brings us more happiness knowing that what we've done is effective.
Dr. Vasu, how do you approach discussions with patients who are nervous about undergoing liposuction?
I totally get it if you feel nervous about lipedema liposuction. Indeed, I'd be a little bit puzzled of why you weren't nervous, because it's a natural reaction to something or the fear of the unknown. But be reassured, my job is to tell you everything. What to expect, what should happen, what shouldn't happen, and so on. And in my experience, the more information I give you and walk you through the process will help you alleviate that anxiety. Another thing you can do is speak to other patients. And I think the more you speak to other people and learn about other people's journeys and how it's helped them and impacted them will help with your anxiety. Lipedema surgery is big surgery. It's important that you understand what you should expect afterwards.
Dr. Vasu, what are some common emotional challenges that lipedema patients face, and how can you help them through that?
In my experience, lipedema sufferers have a range of emotions, ranging from anger, frustration. They can suffer from depression. It can even lead to the breakdown of relationships, and I've seen it firsthand. It's not surprising. However, I think there are a number of things that one can do to help you overcome those emotions or to address them to some extent. Be part of a community. Learn about the disease. Learn what can and can't be done. Educate your partner. Make them part of your journey as well. And you'll be surprised how supportive. I have seen firsthand how partners can be. It's quite astonishing. That's all one can do. Know that there are people out there who can help. Know that it's not in your head. This is not a made-up disease and that you're overweight and you must be secretly eating. That's all nonsense. Lipedema is a real problem, and together as a community, I think we can make some headway.
What advice do you give to patients who are struggling to accept their bodies before considering surgery?
You know, I had a really humbling conversation with a patient relatively recently. This is a lady who was older. She was in her early 60s and she'd suffered from lipedema all her life. And she said to me, when I look back at my life and I think about all those years, I hated my body, I couldn't accept it, and I was down about my body. I've realised I've wasted so much time, and I wish I hadn't done that. It's easy for me, as someone who doesn't suffer from lipedema, to tell you to go and accept your bodies and so on. But when you're faced with this problem, I think there has to be a degree of you have to enjoy life and just get on with it. Because if you don't, it will become all-consuming.
Dr. Vasu, how do you build trust with your patients to create a safe and supportive environment?
When you're seeking treatment for lipedema, it's really important you have good communication with your doctor. And it's important that you feel listened to. So during your consultation, in preparation, make a list of questions to ask. Your gut feeling will tell you if you're feeling listened to. In my practice, I do send patients a very long letter afterwards with lots of information, and it also covers what we've discussed. I routinely offer my patients a second consultation because often receipt of that letter might stimulate more questions. Ultimately, your gut feeling will tell you, is this the doctor for me? There's no right or wrong answer. You've got to feel comfortable. At the end of the day, you've got to be comfortable with the decision you make.
Dr. Vasu, what role does empathy play in your practice? especially when dealing with sensitive conditions like lipedema?
Here's a controversial thought. I think your doctor or surgeon having empathy with your condition is key. If you're going to seek lipedema treatment, it's important that your doctor is on the journey with you. This isn't transactional. This isn't a one-off. That you go in, have something done, and you disappear forever. You've got to have that trust that whoever you go and see, that they understand what you're going through, what impact it's going to have for you, and that they're there for you if you have any concerns in the future, because it's a journey. And it's important that you are supported throughout it.
What message do you hope lipedema patients take away from their experience with you and your team?
Here's one key takeaway that I want patients to have after treatment with me. Lipedema surgery offers hope. So for those patients who have terrible symptoms, who are completely debilitated by the disease, there is treatment available. And that treatment can restore your quality of life.